To start us off with your 1-minute introductions, Senator Lee.
Thank you very much. I was here a couple years ago, and I said a lot of you know me here in town. Heidi and I moved back here. Heidi's over there. Back in 2000 to raise our 4 children. You heard I served on the Port Authority. I've worked with many of you in the nonprofit sector. I was on the State Board of Transportation, and I've served in the North Carolina Senate now in my 4th term. So I was surprised to hear from one of my volunteers at a meeting. They said, so how long have you lived here, and do you have kids? And so that kind of surprised me, but it made me think that we need to do something differently. So what we did, so that people could get to know us better, because 1 minute isn't nearly long enough, is we created a series of videos that Heidi talks, I talk, we explain how we got where we are, why we think like we do. It even has our kids and some of our friends in there. So I hope you'll go to the website. They're called Michael Unscripted. So you can learn a lot more about me. And all these, with all the campaign ads that are out there, these videos, people have told me, are the things that they want to see from candidates to know what they think, why they think it, and how they got there. Thank you.
Dr. Hill.
Thank you so much. As you heard, I'm Dr. David Hill. I have lived in this community for 22 years. I have built and sold a business in this community, so I'm thinking along the lines of a lot of people in this room. I have another one. My wife, Christy, and I have raised 5 now adult children here, and I've gotten to work in a lot of healthcare settings and talk to a lot of people. In that time, I have come to realize that the things that I want to do for the children and families that I take care of are not things that are really in my control in an exam room or in a hospital. They're things that happen in Raleigh. Do we have safe water to drink, which families are constantly asking me about? Do we have fully funded public schools that can meet the needs of every child in every community in this state? Do the parents that I see have jobs that allow them to afford to buy the fresh food that I think they should be feeding their children? That's what I have come here to do with the problem-solving technique that I use as a doctor. Just find the best evidence. Thank you.
Thank you very much. So to start us off broadly, first question is going to be, if you are sent to Raleigh, what 2 local issues will be at the top of your priority list? And just like with the commissioner candidates, we randomize the order, so there might be some back-to-back openers, but there'll be a fair number of who gets the last word. So starting off with that first question is Senator Lee.
Wow, there's so many different things. I mean, infrastructure primarily, as many of you know, I've really focused on infrastructure, whether it's the $171 million over the last couple of budgets we've been able to get for the CFPUA, finding extra funding for roads. As you probably know, that usually comes from gas tax and also fees. And what we've done is we've now taken some of our sales tax. We're increasing that by $750 million. Mental health is incredibly important. We spend a lot of time and a lot of money investing, not just with Coastal Horizons and other nonprofits, by expanding Medicaid. So those are some of the things we really need to focus on. We really also need to look at our economic development. That involves infrastructure, involves incentives, whether it's a film grant, which I tripled, made it recurring, but also focusing on workforce. I see Jim out there with Cape Fear Community College. We've done a lot with short-term workforce grants, and we're now moving into the middle schools with career development plans so kids can start thinking about things a little earlier. The Chamber's got an amazing program as well with middle school students, exposing them to the various industries in town. And my time's up.
Dr. Hill.
Thank you. So whether I'm in exam rooms talking to families, whether I'm knocking on doors as a candidate, I hear the same thing over and over again: the economy and housing. Wilmington has actually done a pretty good job in encouraging housing, but that is a model that can be brought to the entire state. There are grants that we can give for workforce housing, for student housing. We can cut red tape. We can make it easier to build so that the workforce that comes here is able to live where they're working. That has some ecological advantages as well when people aren't commuting all over the place. Second is education. Economically, look, I get recruited about 3 times a week to move somewhere else and be their pediatrician. No recruiter has ever called me and told me that if I move to this place, there are some excellent private and charter schools that if I get in line and my kids pass the exams and they like the way my family looks, I can go to those schools. They tell me there are excellent public schools. That is a critical economic issue that I cannot wait to tackle.
On another economic question, what role do you think the state should have in supporting or not supporting construction of new electric vehicle and electric vehicle component manufacturing facilities like the Epsilon project in Brunswick County? And on this one, Dr. Hill's going to start.
Thank you so much. So I'm a little biased. I drove here today in a Tesla Model 3. It is my third EV, and I got to tell you, I drive that thing not as an ecological move, but it's just a better car. I don't know how many of y'all here have one. Those things are fast, and they require almost no maintenance. I never take it in for an oil change or a filter or a pump that's not working. This is the future, regardless of what the government does about it. So we want to get out in front of that. The money is coming. China is competing with us successfully. We need to take that mantle back from them. North Carolina has been a beacon of technological development in this entire country. We know we've got it. We've got the education, we've got the workforce, we've got the infrastructure, and I think we need to give that a boost because this is where everything is going, regardless of what you think about it politically.
Shirley?
From a workforce development, whether it's Toyota up near the Triangle area or what's going on in Brunswick County, it's important to bring high-paying jobs, good manufacturers, and good employers to our state. However, we do have to be careful. There's a lot of PFAS in batteries, there's PFAS in solar panels, and those are the kinds of things that we really need to be careful of. And so we funded an emerging compounds unit with DEQ in case there is some emergency spill. We're doing a lot of research, and we're doing a lot of studies with human exposure. These are the kinds of things we need to think about. We really need to focus on economic development, workforce, high-paying jobs, especially in this high inflationary environment that we're in. But we also need to make sure that we've got the guardrails there to make sure that manufacturers are doing what they're supposed to do, especially when we know that there are certain compounds contained in the things that they're manufacturing. And so with those two things in mind, I think we can do both. We can walk and chew gum at the same time. We just need to make sure we are keeping our eye on the ball.
Thank you. We have an audience question about PFAS and water quality. Will Sitten asks, how are you planning to combat PFAS and forever chemicals in our water supply with stricter regulations from the EPA? And Dr. Hill, again, will start.
Thank you. So this is a question that I hear all the time in my exam room. Patients are asking, do they need to buy bottled water? Do they need a whole house filtration system? What's going on with their kids? And we know that the PFAS, which our community was exposed to at twice the levels of high PFAS exposure of other communities, contributes to things that I see. It can cause delayed development. It can cause low birth weight. How much? That's an open question because we have not put the money toward large-scale demographic studies. Some other things where we haven't put money that I think we should put money. I think we need to actually invest from the state level in stopping PFAS emissions at the source. It has not been done. We have not asked the PFAS polluters to actually pay for the cleanup that our county and Brunswick County are currently doing. We have not stopped putting PFAS into products, and we have not come up with state-level quotas for what's allowed and what's not allowed. I'd love to use the state to do all those things.
The state has gone after Chemours, but that was the administration. The legislature didn't have anything to do with that. They entered into a settlement agreement. We didn't agree with it. CFPUA didn't agree with it. That's why they're suing them. We need to walk and chew gum. We need to have good enforcement. We created the emerging compounds unit. We actually do have wide-scale studies in southeastern North Carolina. It's recurring funding of $4 million a year to make sure that we know what the exposure and impact is. We need to invest in filtration technologies. We didn't have it back in 2018. It didn't exist in the world. We wouldn't be here today where we have these novel sorbents that take PFAS out of the water. You wash them off, you can destroy the PFAS and reuse them. We would not be able to do that. But we can't just talk about enforcement. We have to talk about this filtration. We have to talk about studies. We're doing it. We've invested more than any other state in the country, $50 million into research. That has leveraged another $150 million from the NIH and others in those studies. I went to a conference in Seattle to talk about what we're doing with a collaboratory, partnering private scientists with DEQ, being embedded so that we can do the best possible thing that we can for our citizens and keep them safe.
Thank you. Ashley Garner from the audience also has a question. The only solution to affordable housing is increased supply of housing. How do you plan to facilitate the development of more housing while protecting and improving both our fragile environment and the quality of life in southeastern North Carolina? Senator Lee.
We need to have good regulations around stormwater and other things, and that's what we're doing. I talked to the DEQ secretary last week before she stepped down. We were talking about those things. We were also talking about the different standards for water quality under NPDES permits, and those are the permits that you have to get before you can discharge into a water source. What we're doing from the affordable housing is we're funding the Housing Finance Agency that really works with affordable housing, those at 60, 80% AMI and below. The other things we can do is kind of streamline unnecessary regulations. We funded, I think it was close to $1 million to a safe place where they would take in women who have been human trafficked. It took them over 6 months to get their building permit for 2 houses to house those women. Think about that for a moment. Something we desperately need. We've got to find ways to streamline it. We've done it. We've worked on some of the building code modifications, and in fact, I think County Commissioner Zappel asked me if we could tweak it a little further. But these are the things that we need to be looking at. It's not an easy solution, but I know we can help at the state level.
Dr. Hill.
New Hanover County has done one of the best jobs in the state at building more housing. It's still not affordable for a lot of folks. I've got 2 college-age, just after college-age daughters who are moving out into the workforce and looking for housing, so that is an issue that I deal with every day. I have parents who are facing housing insecurity, so obviously we need to do more. Streamlining the ability to build houses is really critical. If there's a piece of red tape that's not doing something important, let's get rid of it. There are options for housing grants, for workforce housing, for student housing. We need to maximize the use of those options. We also need to build smart. I live in the southern part of town where a huge amount of building is going on, and there are fantastic models down there where mixed income housing is all being built together, including low income housing right next to high income housing. That works great. Let's double, let's triple down on it.
In the wake of the Supreme Court's reversal of Roe versus Wade, a number of states, including North Carolina, changed their laws governing abortions. Last year, the legislature passed new restrictions, and an override of Governor Cooper's veto fell along party lines. It once again has become a leading issue in this year's election. If elected, what changes, if any, to the current rules would you support? And Dr. Hill is up first.
Thank you. So my primary job involves taking care of newborn babies, and that means running into delivery rooms when things are going bad. I work elbow to elbow, side by side with OB-GYNs, trying to save mothers' lives, trying to save babies' lives for much of my professional life. And so when this law passed, I asked my friends and coworkers, what does this mean to you? What is this doing to your practice? And what they told me is they feel like their hands are tied in significant ways when they are trying to save mothers' lives. It's not black and white when a mother's life is in danger. It's often a slope. And as doctors, we're trained to act at the beginning of the slope, not wait till somebody falls off a cliff and grab their hand before they fall. So in issues such as sepsis, in terms of hemorrhage, things where we know what's going to happen, we know we need to act early, they feel like they're not able to. I will close saying that if we went back to where we were before Roe versus Wade is overturned, I think it would be better for business in this state as well, because it affects who wants to move here and work here.
Senator Lee.
I wrote an op-ed before the last election that said I supported affirming a woman's right to choose in the first 3 months, exceptions if the pregnancy resulted from rape or incest in 5 months, if there was a serious fetal anomaly in 6 months, that's 24 weeks, and at any time for the life or health of the mother. And respectfully, Dr. Hill is just wrong. I mean, we use the life or health of the mother. I actually talked to OBs, maternal fetal specialists, design that language so that the folks who really were opposed to it on the far right said that's a hole you could drive a truck through. And I said, yes, but they need the flexibility. And no woman wants to terminate a pregnancy at that point. And that's how we were able to get that exception. Before this law, there was no exception after 20 weeks in North Carolina, except for what he was actually talking about. It created ambiguity. We had to have more certainty and give healthcare providers that protection. People are saying that we banned abortion in North Carolina. It's just not true. Yes, there are restrictions. We've affirmed the right for 3 months, but there are important exceptions that we've embodied in our law to protect women and families.
I was going to say, actually, this is an issue that's become central in both of your campaigns, so I want to allow some extra time for that and do another round of time if you have other points to make, but we're going to start with Dr. Hill first. If there's anything else you want to add to your stance on it.
You know, this is truly, as you've noticed, at the heart of our campaign. And I will just say that what I'm hearing from the people that I work with every day is that they feel that their hands are tied in this case. The mothers that I talk to feel that there's a lot of uncertainty about what they can do. And I just would like to see us go back to where we were.
Is that early?
You know, these aren't just arbitrary rules. A lot of people think that this is something that just kind of came up and it was really partisan. It's not. You know, we discussed this, as I mentioned, with OBs and the subspecialty of fetal maternal specialists. We discussed with folks on both sides of this issue. And I'll tell you the thing that bothers me the most about this issue. You can disagree with me. I think that's fine. Whether you're to the left or the right of me, that's okay. But to not be truthful about it and to mislead people, you know, campaign mailers that say, I banned abortion without exceptions after rape. You know, you're not just attacking me. You're attacking the women out there whose right to access to this kind of health care is already protected by law. So take an 18-year-old that has been raped, hasn't reported it, and she thinks she has no options. That, to me, is what's wrong with what's going on right now in this campaign and in campaigns actually across the state.
Thank you. We have an education question from the audience from Scott Sirkin. Increasing funding for private school vouchers is diverting hundreds of millions of tax dollars annually from our public schools and moving them to private institutions that aren't even required to teach the state curriculum. New legislation allows families that make over 4 times the average household income means they can take advantage of these vouchers. Discuss your support or opposition to this action. And again, I'm reading verbatim from the audience, so take the question how you will. And starting off with Senator Lee.
So we just increased the funding to Opportunity Scholarships. $248 million was non-recurring, just one time. But we increased the annual by $212 million. That's less than 2% of the entire K-12 budget. And if you take all the money together, it's less than 4.5% of the entire K-12 budget to allow parents and families the opportunity to choose the school that best serves their student. That's incredibly important. A lot of times we don't think about it. It's not just about education, although that's really important, that your child gets the right education. The parents are the final arbiter of that. There are requirements in the law, whether it's taking nationally normed tests, providing reports to parents, and other things that provide accountability, but parents at the end of the day are the ones that get to decide those things. If you take the Opportunity Scholarship, we fund them at less than what we fund the traditional public school system. So if a student gets $3,400 for an Opportunity Scholarship, we take the difference in that and what we would have funded that student to go to the private school if they move from public to private, and we reinvest that into our traditional public school system. So in the end,
Thank
they're
you,
actually
Senator
getting
Lee.
more per student.
We're going to have to
because
move
of
to
that.
Dr. Hill now to answer the same question.
Thank you. So I came to this state because it is a beacon, or at least was when I got here, of public education. I came for the top-ranked med-peds program in the country at UNC Chapel Hill. Right now, I don't have my notes in front of me, I believe we're 38th for teacher pay by pupil. We are lower ranked than many other states in terms of pay. And that has a direct economic value in terms of whether people want to come here. As I said before, people come for great public education, not because they might be able to get their child into a private school that might or might not let them in based on the look of their family, based on their religion, based on whether they have enough spots, based on whether they can make up the difference. At a time that our schools need a lifeline to bring teacher pay up with inflation, taking hundreds of millions of dollars into partially unaccountable private schools does not make any sense to me.
We have another education-related question from the audience from Elise. What is your plan for the overpopulated schools and safety of our children? And Senator Lee will start.
Our actually traditional public school population has been declining, not just in New Hampshire County, but across our state. Back in 2010-11, they funded $7 billion. We're now at $12 billion in how we fund education, and that enrollment has declined statewide and here locally. From a school safety perspective, I've funded an AI pilot for here in New Hanover County and Davidson County. I wanted to use it across the state. It's the same company that provides security for the World Cup in Qatar, the Olympics. It's amazing, and I wish I had more time to explain it to you. Hopefully New Hanover County will get that bid closed and we'll get that started to keep our kids safe in schools. It's an amazing program. From a funding perspective, I know a lot of that is done locally here by our county commissioners. I think they've got a plan for that. We also have the public school fund under lotteries, which New Hanover County has received grants from. So those are some of the things that we're working on right now. But a lot of the bricks and mortar does come locally, and it's not on a state level, even though North Carolina provides 60% of every dollar for education here.
So a lot of my job and most of my wife's job as a pediatric mental health provider involve trying to find good educational opportunities for the kids that we serve, whether they're talented and they need something special, or whether they have special needs, they have ADHD, and they need a school that will serve them. And by the way, many private schools will not do that. I have been all over the county talking to teachers. I think we had an 11% teacher turnover rate, and they say that it is simply because they are not getting paid, they're not getting recruited. If we took the money that we're putting into private school vouchers and put it all in public schools, we'd be able to pay our teachers almost $5,000 a year more. That would make the difference in who's here. Now, in terms of safety, I think when kids are bringing guns into school, and I have treated people who have been in those situations, talked to those parents, a safe storage law would go hand in hand with making sure that our school resource officers are fully funded to keep kids safe. Those guns should be locked away.
If elected, what will be your top budget priority next year when the state is starting its new biennial spending plan? Dr. Hill?
I think I'd like to have more than one. But as for one, I think refunding our public education is critical. That is an absolute engine of business development, technology, bringing people into the state. And I think we need to make sure that we go back to being that city on the hill that was the envy of the entire country in terms of our public education system. If I could do two, then I think infrastructure and housing are also critically important. I think we need to look at that and make sure that when these people get here, they have a place to live and they can get to where they're working.
Marilee?
So infrastructure is incredibly important. It's something I've been working on and will continue to work on. I do want to take some time to address some of the things that have been said. North Carolina is number 3rd out of 12 in the Southeast in teacher pay. First-year teacher on a 10-month contract, 12 months of insurance, makes $51,000 in Hanover County. 10-month contract, 12 months health insurance because of the state and local supplements. We've increased funding to education this last budget by 9.5%. I talked to you about what percentage that Opportunity Scholarships is, less than 2.5%. So we can walk and chew gum at the same time. We can give kids choice and opportunity, especially kids with special needs through PISA that we increased by $25 million. It allows kids with special needs to go to a school that best fits their needs. And a lot of private schools, take the Hill School here where my kid went to, they do address dysgraphia, dyslexia, dyscalculia. There are other institutions and other schools around our state that provide those benefits to children. We need to provide an educational environment that best meets a child's needs, not just for people who can afford it. The state needs to support these children. It's not going to schools. It's
Thank you, Senator. Moving on to an issue that's being watched closely by the home building community. There's currently a moratorium in place on changes to the statewide residential building codes, and a new board, a new entity will be created next year to consider future changes to those codes. 6 of the new board's 13 members will come from picks from the General Assembly, which means it'll be solely in the issue of the legislature. So in light of those recent changes and the pace of home building in our region, what's your stance on how any new building standards should be implemented? Dr. Hill.
So I think you definitely need to hear from the people who know how to build houses when you want to build houses, right? We absolutely need that input. If you put all people on that board who don't understand the industry, you're probably going to get some pretty bad choices. At the same time, I think you need to balance that with environmental concerns. Environmental concerns can be addressed, but They require investment. And I think you want people looking at making sure that we don't just put the fox in guarding the hen house in this situation as well. This requires balance. I do think that we need to see streamlined building codes. We need to get houses up. We need to get them up fast, but we need to do that without creating more congestion and without ruining the environment that is another one of the engines of our economy. I cannot wait to get to Raleigh, to hear from all stakeholders in this, find out what everybody thinks needs to happen to solve this problem, get them around the table, and get it solved.
Senator Lee?
The building code modifications is important, and I'm going to agree with a lot of what Dr. Hill said. We need to create efficiencies. We need to get those who are experts in residential building really commenting on it. We do need to look at the environment. We need to look at efficiencies, not just in the cost of housing, but the operational cost of this housing. Commissioner Zappel, as I mentioned, reached out to me about it. Dane Scalise reached out to me about it when we were passing it. It was actually a bipartisan bill before it was vetoed. After it was vetoed, then it was partisan to override the veto. I mentioned a little earlier when we were talking about housing affordability and what the state can do. This is one of the things that we can do. We need to appoint the right people to be on the Code Council, but those are the folks that are going to be in the industry, that are going to be the experts. And naturally, we need to balance all the other things. Again, efficiency, because that goes into cost, and affordability, and also all the other concerns that we have in our state with respect to construction. It's not development, but this is construction vertical.
Thank you, Senator Lee. Our final question from the audience is going to be about workforce development. We know our workforce age population is shrinking as baby boomers retire and future generations are significantly smaller. How can you help ensure that our future workforce is prepared for future jobs? Senator Lee.
We're doing all kinds of things. Jim knows this, so I'm going to preach to the choir here. Short-term development grants. We're doing Propel funding, and I know that doesn't mean anything to y'all, but it's essentially focusing on those high-need areas where we need to educate students, not necessarily making a student that wants to go into construction or something else, take English and science, but get them into the Con Ed courses and provide ways to do it. We're lobbying the federal government for what's called the mini Pell, so that you don't have to use Pell just for four-year institutions or curriculum plans. You can use them for Con Ed as well. But something that we really need to focus on, and that we're focused on in the General Assembly, we're focused here locally. Saw Natalie English here a little earlier with the Career and Leadership Development Expansion Program that they've got. Amazing program for students before they get to community college. We've got the Career Academies where we have middle schoolers that are exploring different options in the summer. And then something we developed on a statewide level is career development plans for middle school students, carrying that through all the way through high school and community college so they can figure out what they're interested in and how to get there.
Dr. Hill.
Thank you so much. So one thing we need to do is make sure that our state is a desirable place for everybody to come and work. I've already spoken on that. Environment, education, support for our workforce. When it comes to education, I've had 3 of my kids go through Cape Fear Community College. I work closely with Wayne Community College when I'm in Goldsboro, and I know how critical these programs are. I've had kids who started taking courses there when they were still in high school, flexing, letting kids start working on the things that they're going to need in order to join the workforce as soon as they're ready, making sure that there are multiple paths to having a successful career that don't all lead through a 4-year college is absolutely critical. And then making sure that our communities are places where people can afford to live and work. That means putting money back in the pockets of people who are just working real jobs. We didn't talk about the earned income tax credit, but putting money in the jobs of working people's pocket and putting working people's pockets. You know what I'm trying to say. Building an economy
Thank you, Dr.
from the
Hill.
bottom up.
So in closing, just like we said with the county commissioners, can you share one thing why someone here should vote for you? We're going to close it off starting with Dr. Hill.
Thank you. My job entails assessing problems for all sorts of different kinds of people, no matter where they come from, different languages, countries, cultures, backgrounds, and then trying to find solutions. Not finding solutions that are partisan, not finding solutions that are ideologic, but just following the evidence where it leads. That also means working with anyone and everyone who can lend a hand. I don't ask other doctors what their political affiliation is. I don't ask the people working with me. I ask, what can you do to help? I cannot wait to bring that approach to Raleigh. I think we have all been disappointed in the partisanship. And that is something that we don't have in a hospital, and I don't think we need it at the General Assembly. And so I've already met at least one of my colleagues who's a Republican and a doctor, Tim Reeder. We've already got 10 things we can work on together. I can't wait to get up there and start that task.
Senator Lee?
Dane stole my answer. Leadership is really what it comes down to. Leadership, not just in, and I have a spreadsheet of bringing, dollars back to our community, over $300 million in this last budget. That doesn't include film, doesn't include the boards, doesn't include a lot of other things that we do. But these are most of them one-time appropriations. Some are recurring, like for coastal horizons and mental health. Leadership is important from a funding perspective. It's important from a policy perspective. There are all kinds of policies because it's not how much you have, it's how you spend it. Also, from a leadership perspective in the General Assembly, a lot of you may not believe this. We vote, Republicans and Democrats, bipartisan, together, almost 98% of the time. I would say 90% of the time, it's almost unanimous. So we do get along. I introduce bills with Democrats. Democrats come to me with ideas. I come to them with ideas. It's all about leadership, whether it's funding, policy, or working with everyone to get things done.
Thank you very much. Can we have a round of applause for our candidates? Again, I want to thank all of our candidates today for having a respectful and thoughtful discussion covering all these issues. I hope this helped bring up the differences between them and help you solidify what you might be doing for Election Day, which we are about 1 month out of for early voting. And the registration for voter registration deadline is October 11th as well. Don't forget your parking passes are on the table, and we will see you here October 2nd for the Biz Expo Conference and Economic Outlook Lunch. You're ready to go. Tickets and information is available at wilmingtonbizexpo.com. Thank you very much.